this morning from Emyria is Dr. Michael Winlow. Michael, good morning.
Yeah, good morning, Andrew.
You've had some important data that you've been talking to this week regarding opioid use by patients at Emerald Clinics. Just spell out for us what you've learned here.
My pleasure, Andrew. Yeah, this is some really interesting research done on chronic pain patients who present for care at Emerald Clinics. We give these patients an individualized care program that involves cannabinoid medicines. And what we had been noticing on these patients was that they were using far less opioid medication. Opioids are a very strong pain treatment. And what we noticed in our patients was they were using less and less of this over time, which is an important thing because opioids can have some nasty side effects, can create dependency, can even lead to some death. As well. In the United States, had 50,000 opioid-related deaths just in the last year. So clearly there's an opportunity and interest in more effective treatments for chronic pain that don't involve opioids. And so we saw through a study of 500 patients over 6 months, a significant reduction in opioid use. If you have a look at the slide now on the screen, you can see that that reduction is most profound for patients who come in on very high opioid requirements when they first see us at our clinic. But this analysis kind of raised some questions for us. We measured this information by asking our patients what they were taking. What we really wanted to understand, though, was could we validate the findings that we were getting in our clinics, first and foremost? Could we look back in time and see what people were doing in the years before they came to Emerald Clinics? Were they simply getting better anyway, and we were just watching them improve? Or were we actually making a difference to their lives and their opioid use as well? And so through this partnership with IQVIA and one of their key data providers, Nostra Data, we were able to get community dispensing pharmacy data, which gave us a very accurate read of what patients were actually picking up in terms of their prescriptions. So not just what they were telling us, what they were actually collecting from the pharmacy. And we were able to look at that data in the year before they came to Emerald Clinics and during care with us. And we noticed that we did, in fact, produce that significant reduction in opioid use, which was very encouraging. And in fact, in the years before they saw us, their opioid consumption was either increasing or staying stable, which gives us confidence that the care that we're providing is actually having the impact that we had hoped.
So you say the reduction here was real, and so a validation of your data integrity, if you like.
That's right. Yeah, that's probably one of the key things that we're most pleased about is that this is a very high validation. There was a very high correlation between the measurements we were taking in our clinics and what the prescription data was telling us, which gives us tremendous amount of confidence in the quality and the integrity of our real world evidence, as we always believe to be true. This is external validation of that, but also reinforces the observation that we saw that a significant reduction was taking place, showing the benefit that our care model was providing.
So what can you use this data for now?
Yeah. So now with this in mind, we can now start to take our care model and approach payers and show that we are having true profound impact. Not only are opioids reducing, but we know that from the additional assessments that we do, our patients' quality of life is improving, their symptoms are improving as well. And so we're actually having a real positive impact on these patients. We can take that data to payers and hopefully get our clinical services subsidized to provide and improve access for patients more generally. The data is also, now that we can be even more confident in its quality, we can now start to subset the patients and look at distinct treatment programs, distinct, I should say, drug development programs for these patient cohorts. So we can really start to find out which treatment's working best for whom and turn those into registered drug development programs for Australia and, importantly, major US markets where opioid harm is a very well-recognized health concern.
What about from an intellectual property perspective when it comes to this data?
Well, that's lying in that data somewhere. The most important thing to understand is the dose response curve. How can we recognize what kind of treatment is going to work for which individual? And if we can help answer that question and recognize upfront what works best for whom, that's where the key intellectual property really lies. That's the novel and non-obvious insights that we think we have a really terrific insight on. And that's what's going to support our drug development programs and lead to IP. Furthermore, I think we're able to now start to look at clinical decision support software as well that we can build from this to improve and guide the decision-making of our clinicians.
Good to see you, Michael. Thanks very much.
Thanks, Andrew. All right. Appreciate it. Cheers.